Hi, David McIntosh, Paediatric ENT Specialist. Middle ear infections and antibiotics. It's a very contentious point, and fortunately we've got some really good guidelines out there to help determine when we should be treating children with antibiotics and when we can sit tight. Now, each case is individual, and it's really important that each and every episode is assessed by a doctor. So what I'm talking about today is, of course, just general advice, just to give you an idea of what goes through your doctor's mind. So, what do we know about antibiotics and middle ear infections? Well, we know it's one of the most common reasons antibiotics are used. So we want to make sure we're using them at the right time for the right reason. Now, it's important to realise antibiotics only work against bacterial infections. Viral infections do not respond to antibiotics. When it comes to middle ear infections, they can be viral or bacterial, and despite our best efforts, unfortunately, we still can't tell the difference between one or the other. So we're a little bit stuck. So what do we look for in making a decision about antibiotics? Well, there are a couple of factors that come into play. The first thing we look at is we look at children where when they present with an ear infection, they absolutely must be given antibiotics, no questions asked, because the risk of not treating it can be quite substantial. So this is not an exhaustive list, but to give you some idea of what is on the list of children that we would treat immediately with antibiotics, where a middle ear infection is deemed to be the diagnosis. This would include the following. Any child under 6 months of age. Now, there is a little bit of controversy even just there as to whether children between the ages of 6 months to 2 years of age should get antibiotics as well. Some doctors err on the side of caution and they use 2 years old as their cut-off point. And this is probably quite sensible. However, under 6 months is an absolute definite. If the child has a problem with their immune system, they have a weak immune system for some reason, they're not going to be able to fight off the infection as well, so we give them antibiotics. If the child has some form of other medical condition, which could be a condition known as trisomy 21, or what we call Down syndrome, or they could have problems with what we call craniofacial problems, which is where the teeth, jaws, and facial skeletal framework is quite different to the average, then we may consider that as well. If the child has a cleft palate, and that can be even if the cleft palate's already had surgery, they are again a high-risk group, and they're the ones we tend to treat with antibiotics. We also look at the severity of the infection. If this child is really, really sick, then we've really got to treat them. Any middle ear infection can turn nasty, and if it looks like it's turning nasty, then we get onto it. In countries where there are indigenous populations at increased risk of ear infections, and that includes back here in my home country of Australia, then we give antibiotics. So that's just a rough rule of thumb for some examples when antibiotics are given straight away. The next step then is which children can we sit on if they don't fulfill those criteria, and which ones do we go on and treat? Now, the first thing is that we know that if we sit tight with a middle ear infection and give it around about 3 days or so, if there's signs of things improving, then that child's getting better by themselves. If by 3 days' time from when it first started they're still quite unwell, then it's time for antibiotics. So that's not from the first time your doctor sees the child, that's from when it first started. So 3 days down the track from when it started, they're still sick with it and not showing signs of improvement, it's time to consider antibiotics. Other things we'd look at, for example, is whether you can get back in to see your doctor. It might be a Friday night, you may not be able to see them on the Monday, it may only be day 1 or day 2. Obviously with the weekend that will add up to 2, 3 or 4 days into the infection. Your doctor might give you a script and say, look, if things aren't getting better, then you might want to get some antibiotics. If the child has something such as a cochlear implant, we'd give antibiotics because we don't want that to get infected. But otherwise, if it's an otherwise normal child, and for example it's an ear infection that's come back within a month of another ear infection, well, we'd probably look at antibiotics for that situation as well. So there's just some rough guidelines to give you an idea about when we give antibiotics. The reality is it's a lot more complicated than what I've played out, but it's important to realise that using antibiotics for the wrong reason is a problem. But likewise, there are very good reasons to use them when the time requires them. Anyway, I hope this video is helpful just to give you some rough pointers in terms of the role of antibiotics and middle ear infections. Have a nice day.